Hi everyone, today we're going to be talking about the new pumpkin seed oil product that we have coming out. So let's dive right in. So what is it? It's obviously the oil that comes from pumpkin seeds or Cucurbita pepo seeds, if you want the formal name. They are very high in several unsaturated fatty acids, vitamin E, carotenoids, and phytosterols. And these are all the constituents that are thought to be responsible for its health benefits on the body. And that includes sort of anti-inflammatory actions, the potential to modify lipids or cholesterols in the body, and then also affect a couple different hormonal paths. So I've divided up the research in three areas: effects on the urinary and prostate, other hormonal effects, and then cardiovascular effects. All right, so we're first going to look at the effect on benign prostatic hyperplasia, or BPH, and the urinary tract symptoms that comes with. And that is when the prostate gland enlarges to the point where it affects urinary function, whether that's increased frequency or actually even the inability to urinate. And the prostate gland itself actually continues to grow throughout the life cycle in men. And so pretty much 85 to 90% of men, by the time they're sort of 80, 85 years old, will have an enlarged prostate to a certain degree, some having symptoms, some not. And there's been multiple studies to show that pumpkin seed does seem to have significant benefit in reducing symptoms associated with an enlarged prostate, specifically with the urinary tract. It has also been compared to standard drugs, and while it was shown to maybe not be quite as effective as pharmaceutical drugs, it did provide significant symptom reduction and obviously comes with far fewer side effects. It should be noted that in order to see the effects, you do need to be taking the supplement for several months, and all the studies out there seem to be sort of done over about 12 weeks or 3 months before they are completed. So that's what I would recommend anyone who starts taking the supplement, is to not make an assessment whether or not it's helping until after that time. In addition to its effects helping the prostate, there have been some studies to just show its ability to help overactive bladder symptoms. And these studies have actually done up to 10 grams a day of oil, which is significantly higher than all the other trials that I looked at for different health benefits. However, there have been trials that have also seen improvements in urinary symptoms with much lower doses. So generally, I would suggest people start at lower doses than this, but I think this speaks to the fact that pumpkin seed oil can be quite safe when you see studies done at such high doses over a long period of time. But someone might have to play around with finding the dose that's right for them, as the range does seem to be quite large. All right, then there have been a few smaller studies on the cardiovascular benefits, and this is likely due to the unsaturated fatty acids within the oil. This particular study was done with women, which was nice to see because very often studies are more often done on men. So this was 35 women that were given either 2 grams of pumpkin seed oil or placebo over 12 weeks. And at the end of 12 weeks, there was a significant increase in HDL, and that is the healthy cholesterol. So we do want to see it come up. And there are actually not a lot of things that do improve HDL cholesterol. So this was an interesting finding in this study. It was also shown to decrease diastolic blood pressure over those that were in the placebo group, which was another benefit to the cardiovascular system. So more studies need to be done, but some good research there. Okay, hair regrowth. This was very interesting. Again, a small trial, so we do need to keep that in mind. However, this was a randomized controlled trial involving men with mild to moderate male pattern hair loss. They were given 400 milligrams a day of the pumpkin seed oil and followed over 24 weeks or 6 months. And at the end of the 6 months, the results show that there was an increased hair count, improved hair thickness, and overall patients were pretty satisfied with the results and had minimal to no side effects. And if we look on the next slide here, so these are some of the images that were included with the study. We can see here this bar graph. We can see baseline, both the treatment and placebo groups being about equal at the baseline. And then even at 12 weeks or halfway through the study, we can see that there's a significant improvement in hair count with those that were given the treatment of pumpkin seed oil, which continued to improve at the 24-week mark as well. And then over here, we've got an image actually of 3 different men, both at the beginning of the trial on the left-hand side, and then at 24 weeks, we can see there is an increased hair growth, which is visible here, which is great to see because very often we don't get to visually see results in a study. We're usually looking at blood markers or anything like that. So this is neat that we can physically see some improvements with this study. Okay, the last study I wanted to look at here was in women. Again, pumpkin seed oil has very often been studied in men and prostate and hair growth concerns, but this was interesting, again, specifically looking at menopausal symptoms. 35 women given 25 grams per day of the pumpkin seed oil or wheat germ oil, and after 12 weeks, there was reported decreases in menopausal symptoms such as hot flashes, headaches, and joint pain, and this was significant over a placebo group, which again is good to see. Dosing, as I mentioned before, it is quite a large range. The lowest dosing sort of around 350 milligrams twice a day. Even the hair regrowth was only 400 milligrams a day, obviously for a long period of time. But then we again have the dosing that go up to 10 grams per day. So it really depends on the individual. I would always suggest that you start at a lower dose and maybe increase because we do know that there can be some side effects, more like gastrointestinal side effects, if you take very high doses of anything. And so I would never want to start someone maybe at 10 grams a day would be a lot. So I would start at a lower dose. For overactive bladder, I'd probably even start lower than 5 grams a day and work up. All right, so who should take it? Kind of what we've already talked about. Men with urinary frequency or hesitancy issues who have enlarged or don't have enlarged prostate diagnosis. Those that are maybe looking for natural ways to improve their hair count and thickness, specifically with male pattern hair loss. And those that maybe want an additional support to their blood pressure and cholesterol levels. And then finally, even women may want to consider this to help with potentially their menopausal symptoms. And even though the study on hair loss was done with male pattern hair loss, there could be improvements in female hair loss too, although I don't want to say for sure because no study has been done. So who should not take it? Generally, it's well tolerated and they're really mild or rare adverse events. The big ones are sort of allergy. If anyone is allergic to seeds or oil in general, you might want to be cautious, or nut allergies. And then I mentioned earlier gastrointestinal effects, especially if you take a high dose. So just start low and go slow. And then anyone taking other medications, specifically blood pressure or anticoagulant medication, should always discuss with their healthcare provider probably before taking this, as this might increase the effects of these drugs, which could be a good thing, but also needs to be monitored. So here's our pumpkin seed product here. Our capsules have 1,000 milligrams of pumpkin seed oil per capsule. So knowing some of the research, we can take it as low as just 1 capsule a day. But it's at a nice high dose so that if you want to get into that gram dosing, you're not having to take a huge number. Our dosing is recommended of 1 capsule 3 times a day, but again, that could be specific to the individual taking it. One thing that is important is to make sure that you're taking a cold pressed pumpkin seed oil. We want to make sure that because of the high content of unsaturated oils, that we're not exposing it to any heat or light that can cause the oil to oxidize, making it a pro-inflammatory effect on the body and making it go rancid. So we don't want that. And ours here has been prepared in that way. So once it's also been opened, it should be kept in the refrigerator and kept from bright light. As always, if there's any questions, please feel free to reach out. Thanks very much.